Hi Jessica, how are you?
Good.
What are you here for today?
I'm here to have my wisdom teeth evaluated.
Oh, okay. Have they been hurting you?
Yeah, I've been in a lot of pain.
Okay, did you ever have braces?
Never.
Okay, good. Well, let's take a look at your x-ray here. Okay, yeah, your wisdom teeth aren't in good position and someday they have to come out. It's better to have them out now before the roots fully develop. Once the roots fully develop, it requires more surgery. There's a little increased chance of having nerve damage. All right? When you do get them out, we're very careful of your nerves. You can see one here and one here on the lower teeth. But in rare cases, patients will complain the next day of having some numbness on their lip, a little bit like having Novocaine shots in your mouth. If that occurs, it's almost always temporary. Your chances of getting it is less than 1%. And in the young, healthy patient, it's usually not a problem, and within a few weeks or a few months, it resolves itself. No further treatment is necessary. In extremely rare cases, it can be permanent or painful. If that occurs, we can treat that, but in your case, I don't think you're going to have that problem because you're getting them out before the roots are fully formed. It'll be highly unlikely you will get that problem. When you come in, we're going to put you to sleep and do all four at one time. So you don't get sick from the anesthesia. You cannot eat or drink for 8 hours before your appointment time. One exception, and only one, water. You can have water by the glassful up to 2 hours and you won't get sick. So if it's more than 2 hours before your appointment, you're hungry or thirsty, you're going to have a big glass of cold water. Just before you come in, brush your teeth good, rinse good with mouthwash, and spit everything out. That'll lower the germ count, so you don't get a dry socket or infection after the surgery. You also have to bring a driver with you. It's a state law. If you don't have a driver, we can't put you to sleep to do the work. Ask your driver to stay, because the procedure only takes around an hour or so. That's putting you to sleep, taking the teeth out, and recovery. We use light, safe office anesthesia. We put your mind temporarily asleep so you don't remember or feel anything we do, but it's light, safe office anesthesia, which means you wake up much quicker than you would if you were done in the hospital. In the hospital, when they put you to sleep, they usually put a breathing tube down, paralyze you, and it takes a lot longer to wake up from that kind of anesthesia. Here, you breathe on your own, and so you're up much quicker. All right? We put you to sleep with an IV. We freeze the skin with a spray, and we use a little baby butterfly needle usually, or a little tiny needle, intracath. So most patients say, I really didn't feel that much, so don't be afraid of that. Do you have a problem with needles? Do you ever faint or anything when you get a needle? No? Okay, so you're pretty good with that. Okay, good. Finally, our staff at the desk is trained to check your insurance to get you the maximum benefit possible. If you have a benefit in there, they'll check all the insurances, dental, medical, whatever you have to try to get coverage for you. All right? They'll also give you a slip of paper and you'll read that over and sign it about how they do that for you. Okay? Any other questions or concerns? Okay, good.